Thank you so much for joining me here at the live desk. I am Janae Hancock. Today it is Friday, but it is also October 6th. And it is also Breast Cancer Awareness Month. And typically when we think of breast cancer, we think of women, but men can get breast cancer as well. So with all of that being said, I do want to bring in our guest for today here at the live desk. You are taking a look at Dr. Jamie Wagner, Division Chief of Breast Surgical Oncology. Dr. Wagner, thank you so much for joining me here at the live desk. How's it going for you?
Thank you for having me. This morning's been great. We're off to a great start.
Good, and it's Friday, so that's always good news. I do want to jump straight into it. The topic for today, how often or how rare is it for men to get breast cancer?
It is not common for men to get breast cancer. Only about 1% of men will get breast cancer.
And speak a little bit more about those statistics, especially here locally. Are we seeing a rise in men getting breast cancer?
When we look at both local and national data, we have not seen or project to see a rise in the incidence of male breast cancer. However, we have known for quite some time that there is a higher risk of breast cancer in men who have a genetic mutation, such as a BRCA mutation. Those patients or those men that have this passed down throughout their family do have a slightly higher risk than the average population.
And with men who get breast cancer, is there a typical age range? Is it above the age of 50, or what age range should we really be looking at?
It's not quite like what we see in women, where, in women, we know that the most common ages are in their 50s, 60s, and 70s. I would say we do see it slightly more as men age in their 50s, 60s as well, but it doesn't negate that men in their 30s can get breast cancer just as much.
So you definitely don't want to rule it out, but I did mention at the top of this live stream that it is rare, and we've touched on that. But what are the signs and symptoms that men can look out for, that women can tell men to look out for?
It's actually quite similar to what we advocate for women, is knowing your own body and having self-awareness, so that if you feel something in your breast, because men do have breasts, it's not just the muscle, that if it's a new nodule, that they really need to get that checked out. It will be firm, mobile. We don't want to think about that breast cancer doesn't hurt. There can be pain associated with it as well. So anything that was not there previously, it's new, it's different, they need to be their own advocate and have that looked at and have appropriate imaging performed.
And this is an extremely important topic, not just to focus on during the month of October when we try to raise awareness, but also throughout the entire year. And, throughout this month specifically, we hear a lot of different stories about people speaking out about how they found out they had breast cancer. Now, with that being said, we do know that a father of four was just diagnosed with breast cancer. His name is Jeremy. Tell us a little bit more about Jeremy and how he found out.
Jeremy, I think, is the poster child for being your own self-advocate when it comes to your health. He had other small fatty nodules on his arm, and when he felt something in his breast, it felt different. So I think he had a good comparison, and because it was different, he continued to seek help. And their first couple of times, it was a little bit displaced based on his young age at 35, when this originally happened in 2019. Also saying you're a male, you're too young. There were a lot of different variables that were somewhat written off that this couldn't be a breast cancer, but in his gut, he wanted it checked out, knew it was different and wasn't supposed to be there. And fortunately, he found the right person that got him a mammogram and ultimately led to a biopsy showing breast cancer.
And we'll hear more about Jeremy's compelling story during our evening newscast, but I want to take a look at this file video as I ask you, Dr. Wagner, what can men do to reduce their risk of getting breast cancer?
Well, we look at risk reduction for women, but it's not quite the same with men. Overall, I would just advocate for healthy lifestyles. Right. We know that high alcohol intake can be a risk factor, as well as patients really trying to be at an ideal BMI, because obesity in particular, when we think about male breast cancers, the majority are hormone positive. And when we have a higher BMI or higher fat content, our estrogen cells or our fat cells make estrogen. And so that can be a risk factor that we do have some control over.
Perfect. Okay, Dr. Wagner, I know you have a busy day ahead of you on this Friday, so thank you so much for joining me here at the live desk. As far as our viewers, we will continue our coverage here at KCTV5 on Breast Cancer Awareness Month, and we'll have much more on Jeremy's story that we touched on here during our evening newscast, so be sure to look forward to that. But for now, have a wonderful Friday.